specific reason why I chose this topic today was because it's Mental Health Week, Awareness Week. The 5th to 11th is Mental Health Awareness Week, and so we decided that we can have this as the topic. So it's appropriate at this point of time to promote mental health awareness, basically. There's no health without mental health. So, what is mental health and illness? Mental health is a state of well being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own communities. This is the definition given by Centers for Disease and Control and Prevention. Like I said, it's Mental Health Awareness Week, and this is how we are trying to contribute towards the awareness of for mental health. Stand up against stigma, no health without mental health. That's the message that we're trying to put forward. What you need to understand about mental health is that 42% of people with mental illness face stigma and discrimination at least once a month. 58% of sufferers say the stigma and discrimination is as damaging or harder to deal with than the illness itself. So mental illness is not that difficult to deal with. It's the stigma and the discrimination that's more difficult to deal with. 63% of adults know someone with a mental health problem. So all of us know someone with a mental health problem. There's no way you will not know anyone with a mental health problem, because 1 in 4 people do have depression. So yeah, maybe even more. Mental Illness Awareness Week, October 5th to 11th. 1 in 4 people live with a mental illness. Speak out and end the stigma.
Like ladies do. Ladies usually do it.
Absolutely. That's why.
They fight the power.
Absolutely. They let out that steam. They release that negative energy within them, which is why they are much more resilient. Between men and women are much more resilient because they have those inbuilt mechanisms which help them ventilate and let out the steam. 60% of adults with a mental illness received no mental health services in the previous year. About 2/3 of children with a diagnosable mental illness have not received treatment. So this is how far the stigma is affecting the way we look at mental health or mental illness. Things you need to know about mental well-being. 50% of adult mental illness starts before the age of 15. 76% of report that they monitor the well-being of their staff. That's in trusts and organizations. 1 in 4 of us will experience at least one mental health problem in any 1 year. 3 in 4 of people suffering from mental illness get no treatment at all. 50% of adult mental illness starts before the age of 15, that I already told you. 8 to 12% of the population experience depression in any year. When we say 3 in 4 people don't get mental illness treatment, is because treatment is also very expensive. In a country like India, where at least 60% are below the poverty line, it's going to be very difficult for people to seek mental support from the system. And even if you go through the system, it's such a long drawn out affair that you might never get the therapy that you require when you need it at that point of time. So these are the qualities you need to inculcate in yourself if you want to fight mental illness or keep your mental health stable. Faith, resilience, strength, courage, hope, love, family, awareness, cure, support, courage, remember, hope. So these are just pointers. So you need to care for your mind. That's the crux of it. If you're struggling, you deserve to make self-care a priority. Whether that means lying in bed all day, eating comfort food, putting off homework, crying, sleeping, rescheduling plans, finding an escape through a good book. A lot of people, what happens is we get so regimented in our daily routines. We tend to say, okay, if we're waking up at 4, we need to wake up at 4 every day. But that's putting another stress on you. What you need to realize is, if you let go of,
Binding you.
yeah, you're binding it on yourself.
In bed all day is a very bad thing.
It's a bad thing if you're doing it
Because
every day.
that person is only is not sleeping.
No, no. What I'm
And when you lie,
listen to me. Listen to me. Listen to me. I'm not saying lying in bed all day forever. Lying in bed all day once in a month, once in 2 days, once in 3 weeks, it's fine. Nothing wrong with it. Because that's the way your body needs to de stress.
when your body is not active, you see that particular person gets all the
No, that's wrong. That's a wrong notion. See, that's what I said. When you get regimented in your thinking, what happens is you put extra stress on yourself.
So actually what I tell people and what I do that we say keep yourself more active, more active. When you feel low.
No, that's true. I'm not saying no. But when you say active, it has different connotations. It has different connotations. Some people need to de-stress their mind. So if you keep your mind active, your mind is not getting de-stressed. It's not. If you're keeping your mind active, then the stress is only increasing because you're putting pressure on your mind. So when you're stressed out, what you need is to de-stress, and the de-stress can be anything. What you require. It's not a regimented plan that what everyone follows you need to follow. That's not the way it's done. If you feel that you need to just lie down and relax, that's what you need. There's nothing wrong with it. Don't try to think in terms of regimented patterns where people tell you that if you lie down all day you're being lazy or you're doing this or you're doing that. Don't worry about all that. Yeah, that's not laziness. That's yeah, you require it, you do it. Don't worry about what other people are telling you.
Then go shopping.
Yeah, whatever it takes to make you feel good about yourself.
Have chocolates.
Have chocolates, that gives you a high, absolutely. Watch your favorite TV show or do nothing at all. Give yourself permission to put your healing first. Quiet the voice telling you to do more and be more, and today whatever you do, let it be enough. Feel your feelings, breathe, and be gentle with yourself. Acknowledge that you're doing the best you can to cope and survive, and trust that during this time of struggle, it's enough. You can do anything but not everything. That's something you need to understand. So these are just some examples that you could inculcate in your daily mental health care list.
Chocolates also. Yeah, sorry, I find it echo. I heard that chocolate.
What?
That mind chocolates.
Chocolates.
But there are only certain type of chocolates which cool down the brain, not all.
No, Cadbury's basically, not the lozenges and stuff.
All, but they are available here in
When we say chocolates, yeah, cocoa. We are talking about cocoa. No, cocoa related chocolates, not the other ones.
not that. Cadbury chocolate.
Not the candies.
All Cadbury chocolates are not cocoa related.
All Cadbury chocolates are, except for the milk chocolates. Everyone else is,
Chocolate has some amount of
yeah.
There is a cocoa which cools down.
Yeah, the cocoa is not no. It's not that it cools down. If you're feeling low, it gives you a high. It raises your
The bitter ones,
endorphin
the bitter ones.
and all chocolates. If they have Cadbury in it, if they have cocoa in it, they are liable to give you a high. Yeah. It's like coffee and tea. They have those ingredients that raise your endorphins.
Are you sure?
Carbohydrates, absolutely. Potatoes are energy giving, right? Anything that gives you energy increases your endorphins. Makes you feel good about yourself.
Laughing is the best.
Yeah, absolutely. When laughing is good. The self-care project, because self-compassion is not the same as self-indulgence. So we're not talking about indulge yourself, take care of yourself. So like when you said lying in bed all day, I'm not saying lying in bed all day for a whole week. I'm saying lying in bed all day for one day when you're feeling really stressed out. So that's indulgence. That's not self-care. Become a priority in your life. People with mental illness die earlier than the general population and have more co-occurring health conditions. So if you have a mental illness, the chances are that you'll have lots more illnesses attached to it. 68% of adults with a medical illness have one or more chronic physical conditions. It's not selfish to love yourself and to make your happiness a priority. It's a necessity. I know people around you will tell you that you're being selfish, or if you're no, there are. I mean, people will tell you because they want you to do things for them. So they will tell you. They're not going to care about you, but you can care for yourself. You need to
Tell others because then that's what they will think of you.
No, because even when you're totally stressed out, you're still doing things because you feel.
what you want to do for yourself.
Absolutely.
We'll have a nice session after the talk.
Definitely. Mental health is real. It's not a joke. It impacts everyone. It needs to be accepted.
Absolutely.
Real. Give your well-being a boost. If you're facing in the right direction, all we have to do is keep on walking. So fresh air, exercise, get enough sleep, take breaks, take great food, sunshine, meditate, people, stretch, laugh. Do everything that it takes to make you feel good about yourself. So all this basically contributes to your well-being, spirituality, personal space, career, job, relationships, playtime, hobbies and fun, friends and family, wealth and health. But we tend to neglect them when we give one thing more priority than the other.
Balanced.
We need to have a balance in everything. So this is how you can make sure that your mental health care is optimal. Diet, exercise, stress, mastery, relations, finances, work, play, healthcare, environment, life purpose, and self-esteem, and spirituality. So self-care is about physical, psychological, professional, personal, spiritual, and environmental. Right?
All have
And
to be
emotional.
balanced.
All of them have to be
Equal
in
balance.
balance. Yeah. So when we are stressed out, we suffer from burnout, we suffer from compassion fatigue, depends on the kind of work you're doing. You suffer from vicarious trauma also. And burnout is when you're working too hard, you're stressing yourself to a point where your body starts breaking down. And you almost have a breakdown. So
What is vicarious?
I'll explain.
What is what?
Vicarious trauma.
I never heard that.
Yeah. So compassion fatigue is when you're always doing things for others, when you're always caring about others and you don't get anything in return, and then one fine day you feel that you're doing too much and you just don't want to do it anymore. That's when you get compassion. When you come to that extreme point.
That's why they say social workers are the most depressed.
And there that burnout
exactly.
starts.
Yeah. Social workers, psychiatrists, counselors, caretakers.
It's like they earn money. Social workers don't earn
No,
money.
but when you earn money or not, you still get depressed. Because you're dealing with mental issues on a daily basis.
And continuously that negative is bombarded.
That negative energy is coming at them all the time. So they absorb it also. I mean, you can't block everything. You tend to absorb a lot when you're
Right,
dealing with
right.
people.
And continuously you have to explaining and all these things.
But the psychiatrists are not trained that we don't think
much
the
ever
negative,
You're still a human
They
being.
are human beings.
You're still a human being. No?
don't think the negative of the person when you go.
It's not that
It's
easy.
not possible.
It's not that easy.
Like you know, sir, when you go home, just frankly, don't leave your,
It
don't take your
doesn't
It is
troubles to
easy to
bed.
say.
It doesn't work that way.
This is the same. No,
You have the training, you're taught how to do it, but there are times when you don't have the time to even do such things.
And some emotional attachment is always there.
So
If you don't
it's,
have time to unwind,
they don't take your troubles to bed.
it's a
It's
very
ideal.
essential life
Correct.
skill, but it's not optimally used every day. That's the sad part. of it.
you need that time to unwind
you need the time
and
to unwind.
sort out your feelings before you sleep. Otherwise you slept
Absolutely.
with those things and again you wake up with those.
With the same thing
Yeah.
traumatizing you
And
for the
again
next
you go
day.
through the
Yeah.
whole day
Absolutely.
with that. It's-
Vicarious trauma is when someone is suffering from trauma and you are identifying with it and you are
Oh,
also
okay.
experiencing
Okay.
that trauma yourself.
I
because of
know.
it.
Oh.
Yeah. So that's the kind of trauma that a lot of people experience that also because somewhere it links to your past or some experience that you had and because of which you start experiencing
Oh,
that trauma which they are experiencing
That part of personality comes up.
comes up. Yeah, absolutely.
Yeah, because then you're trying to empathize with the person at that moment, and while empathizing, you are
Yeah,
you tend to
bringing
get
it to the
involved in
fore.
that.
And then you try to.
There was one
imagine-
movie also on that.
Yeah, absolutely. There were quite a few
Quite a
movies.
few.
See, that is an extreme case, but in a day-to-day life also,
Yeah.
when we get people here in the library also.
Yeah, absolutely.
Oh, you
Everywhere.
experience
I'll
here?
tell you after.
Everywhere it happens, even in any professional workplace also. If you're in the HR
Yeah.
and you have to deal with people on a regular basis, you're likely to get
Yes.
affected. Stress relief activities could be anything that makes you feel good about yourself. It doesn't have to be anything specific. So you could read a good book, watch your favorite film, engage your visual senses in painting or photography. Allow yourself to daydream for 10 minutes, use visualization techniques. Evoke good memories from your memory or storyboard. Sit outside and enjoy the sounds, listen to a favorite piece of music. Listen to some sounds, tapping water. The sound of water is very soothing.
Yes.
Right? So that's something that you can also use in your daily mental health care for yourself. Listen to a motivational recording. A lot of people like to listen to Gayatri Mantra or some gurus talks, anything. And even channels on television channels now have
Yeah.
morning shows where they talk about religion and spirituality and they try to give you that meditation techniques and lots of things happening around you. But we don't utilize them to the best of our needs.
And now they have started charging
Yeah.
3 rupees per month.
Play a relaxation CD, listen to a radio program with your eyes closed. Sing, laugh, have a chat with someone who listens, chew a piece of sugarless gum, use deep breathing exercises, eat a piece of dark chocolate, use deep breathing exercises, repeat affirmations out aloud. You understand? Repeat affirmations.
Yeah.
out loud?
Yeah.
I'm good, I'm healthy,
Talk
I'm
positive about yourself.
Positive present tense.
Positive in the present tense. Gradually it will seep into your subconscious mind,
Yes, yeah.
and then the subconscious mind will
You start.
will affect your conscious mind. So that positivity will come through.
Very, very
Great.
strong.
Yeah, very strong. Burn some aromatherapy oils.
That is also good.
Enjoy the aroma of scented candles. Do something like baking, a mixture of aromas and soothing movements. Enjoy outdoor smells from walks in the country or near the sea, freshly brewed tea or coffee, like we said before.
Yeah.
Exercise, squeeze a stress ball, stroke a pet, wear soft warm clothing, bake, play a musical instrument, have a massage, yoga or pilates. That's a form of exercise. So what you need to do is you need to relax, take your medicines on time, accept reality, let people help you if required. Don't forget to laugh, like you said. And comfort foods like oatmeal, peanut butter, jelly, chicken soup, macaroni and cheese, smoothies, ice cream, mashed
Now
potatoes,
tasting.
and vada pav. I mean, potatoes
I
is
go for
How watering, how watering.
just straight head to the.
absolutely.
I never knew about the vada pav.
7 steps to evoke the relaxation response. Step 1, pick a focus word or short phrase to repeat. Sit quietly in a comfortable position with your eyes closed. Relax your muscles. Breathe slowly and naturally. As you exhale, repeat your focus word or phrase silently to yourself. When other thoughts come to mind, simply say to yourself, "Oh well," and gently return to the repetition. Continue for 10 to 20 minutes. Sit quietly for a minute or so, allowing other thoughts to return. Then open your eyes and sit for another minute before exhale. So this is the step-by-step methodology involved in relaxation. You can use it for yourself. You can practice it yourself. You have to learn to say no without feeling guilty.
Most
A lot of times we tend to say yes because we feel that
Out
the
of
other person,
obligation,
out of obligation.
There's a book, don't
Because you can't say no.
There's a book like that.
But you need to learn to say no because that is the one, that is the most empowering word for everyone.
So Thomas, there's a book and a good bestseller. Don't say yes when you say no.
When you want to say no, absolutely yes.
I don't know, remember the author.
Yeah,
I have a good book.
Yeah, I remember that. I remember the book. I read it. I think even Pink is about saying no.
Picture, movie.
The movie Pink, yeah, is about. I'm not talking about the sexual
Correct.
part. It's basically about saying no. Rest and self-care are so important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. You must keep that in mind
It's
also.
making more noise.
Absolutely. So this is a checklist for self-care. I mean, we've already covered this. Most of it. Can you read this?
Makes you feel better. We can't read. No, we're not able
Okay, I'll
to
read
Very
it.
tiny.
Overspend, overeat, and overindulge.
What?
That's the negatives. Those are the negatives. Okay. That's not good for you.
People do that.
Yeah.
Even I do it.
Expect others to read your mind and meet your needs.
No.
Withhold success from yourself. Ignore your deepest desires but seek to fulfill the desires of others. Ignore your real emotions and put on a happy face. Push yourself beyond reasonable limits. Allow others to emotionally, physically, or sexually abuse you. Deflect compliments. Say yes because you can't say no. Avoid time alone. Overexhaust yourself because your need to feel important, needed, or worthy. That's the problem. Most of us want to feel important, needed, and that's why we don't say no. Yeah, because we need that constant praise from the other person saying that, oh, this person has done this for me and this person has done that for me. Such a wonderful person. But it's pointless. You don't get anything out of that other than stressing yourself.
Better language.
Absolutely. Fear emotional intimacy. Try to do it all yourself. Never asking for help. Try to appear perfect. Or do you take time for yourself? These are the positives that you need to do for self-care. Take time for yourself. Allow yourself to make mistakes and to be open about your weaknesses. Ask for your needs to be met from a place of vulnerability. Spend time with friends. Rest. Play. Exercise. Eat well. Spend money wisely. Pursue your dreams. Share honesty with others. Enjoy and make time to enjoy and be intimate with those you love. Forgive. Allow others to be disappointed in you. Appropriately express emotions, including anger and sadness. Tell others what they mean to you. Be present for your children. Receive love from others. Say yes and no. Create a powerful support system for yourself. And celebrate accomplishments, big and small. So those are the positives that you need to inculcate. It's not selfish to love yourself, take care of yourself and to make your happiness a priority. It's a necessity. So this is for those who are mobile, who are constantly on mobile. You can keep reminders for yourself on the mobile. Your feelings are valid. You always survive. It's okay to cry. You can just put this on your calendar, whatever you call it, on your diary, in the mobile.
As a reminder.
And as a reminder, so that when you click the mobile, this is the first thing that comes to you. So then automatically you start thinking in the positive way, right? If it feels wrong, don't do it. Say exactly what you mean. Don't be a people pleaser. So these are said in other words. The same thing we are repeating again. Never speak bad about yourself. Trust your instincts. Never give up on your dreams. Don't be afraid to say no. Don't be afraid to say yes. Be kind to yourself. Let go of what you can't control. Stay away from drama and negativity. And love.
Stay away from drama.
The drama and negativity. As in
and play.
hysterical stuff. I mean,
Some
where
people-
the people are overdoing things.
Overview.
I thought you.
No, not theatre. Not against theatre. But drama as
Making a show.
Sure, yeah, bluffing
Making a show.
क्या ड्रामा करता है?
Hiding the identity.
Remember that everyone you meet is afraid of something, loves something, and has lost something.
Yes.
Nothing compares to a beautiful conversation with a beautiful mind. One of the most beautiful qualities of true friendship is to understand and to be understood. Working hard for something we don't care about is called stress. Working hard for something we love is called passion. We cannot become what we want to be by remaining what we are.
Yeah.
With the right music, you either forget everything or you remember the everything.
Complex, concentric circle.
Yeah, basically what it's telling you is that if you're, this is a Japanese term for
Perfection.
yeah, no,
Perfect
it's
feeling.
for mental
Integrated,
health
I
care.
think.
Yeah, it's an integrated chart for mental health care, which talks about if you do something that you love, if you do something that which you're good at, that which the world needs, that which you can be paid for, then automatically it's passion, mission, profession, vocation.
I think
Coming
it's called
together.
for integral living.
Yeah.
Integral living.
Coming together, and that's called ikigai, which is a Japanese term.
Good, perfect.
A lot of problems in the world would disappear if we talk to each other instead of about each other.
Yes.
So that,
Which, because of ego, we don't
true
do
to my mind.
Instead of about each other.
that. Because of ego, we don't do.
Absolutely. Your soul shines like the morning sun. Trust your path. Goodness is coming your way. It's a promise. The shortest distance between a people is a smile.
Yes. It's a link.
Yes, don't want to pay any single penny for it.
Absolutely. You don't have to.
Anyway, we don't have penny.
That's my.
I don't have penny. I don't use penny.
But you don't have time to smile.
I'm smiling all the time. I don't have time not to smile.
Ah.
You see me anytime not smiling.
Always.
Emotions, mind,
It's balance. All that's right.
When we are searching among the branches for what only appears in the roots. Going through hard times doesn't make you strong. Smiling throughout each one does. Are you close to boiling point? Don't let anger get the better of you. So, Hans Sale in 1936 developed a stress model and he called it the General Adaptation Syndrome. It's called GAS. It states that a stressor produces a three-stage bodily response. Stage one is the alarm, stage 2 is the resistance, stage 3 is exhaustion. Okay. The alarm reaction, also referred to as the flight or fight response, is where the autonomic nervous system responds to the stressor, activating the SAM system and the HPA axis and releasing stress hormones. If the danger passes, then the body is restored to its state of equilibrium. If the danger persists, then the body enters stage 2. So that's the alarm.
What is the resistance? We continue to resist.
Denial. We are
Then you are in denial. Coping techniques for stress and anxiety. Like we spoke earlier, the same thing. It's just different ways of expressing it.
Nowadays, WhatsApp. WhatsApp is stress reliever.
Not really.
not really. Sometimes it is stress.
I think it is a stress zone.
Yeah, it's a stressor.
Stress to body also. Continuously like this.
It's a stress reliever if you're doing it in moderation.
Yes.
Yeah.
Moderate.
The moderation.
Yeah.
Otherwise, you get on the
But to
outside.
entertain yourself, we're going
Yeah,
to.
no problem.
Sometimes you enjoy the cash which people do.
You don't have to be an expert to talk about mental health. Talk, but listen to. Simply being there will mean a lot. Keep in touch, meet up, phone, email or text. So this is about relationships, how you need to develop them, because that's very important for your mental well-being also. Don't just talk about mental health. Chat about everything, everyday things as well. Remind them you care, small things can make a big difference. Be patient, ups and downs can happen. 9 ways to look after your mental health. Talk about your feelings, keep active, eat well, keep in touch, ask for help. Take a break, do something and do that. Accept who you are, care about others. So it's physical self-care, lifestyle habits, mental and emotional self-care, spiritual connection and social support are very integral to your well-being.
I need to change.
So now let's talk about depression, because when we've already spoken about stress, now depression is the next step. Medical science is making good progress in unraveling the biological underpinnings of depression. Someday these discoveries may lead to a lab test that can help identify or confirm depression and other mood disorders. Right now, doctors and therapists rely on the symptoms reported by their patients, along with clinical expertise and experience to diagnose depression and determine a course of treatment. Right now the diagnosis of depression is totally based on what the patient gets. Sometimes though, additional information can help distinguish depression from other problems. That's why a doctor might recommend any of the following tests. Psychological tests, during which you answer questions, respond to images, or perform tasks like sorting cards or drawing pictures. These tests can give your doctor a better sense of your coping mechanisms, your temperament, or your ability to organize and plan. That's what the doctor is looking for when they ask you to do those exercises. Tests that look at the brain, such as an EEG or MRI, which can help identify causes of dementia or some rare causes of depression. Both tests are painless. During an EEG, electrodes taped to your scalp pick up electrical signals. An MRI uses magnets, a radio wave transmitter, and a computer to make a detailed scan of your brain. Tests for other causes of depression, such as blood tests to check thyroid function. Doctors generally order such tests only when they note a potential health problem during a physical exam or medical history. So we talked about stress, we talked about tension, we talked about depression. Now we need to look at how we choose a therapist. So there are 10 questions you need to ask when you are choosing a therapist. Whether you get a recommendation for a therapist from your
water and come.
Sure. From your primary, I think this water, this bottle. Whether you get a recommendation for a therapist from your primary care doctor, a friend, or your insurance company, finding out about his or her background and training can help you be comfortable with your choice. Here are some questions you need to ask before settling on a therapist. What's your training, like a certification or degrees or whatever? How long have you worked in this field? What kinds of treatment or therapy do you think might help me? What are the advantages and disadvantages of different approaches to treatment, including medications? How does the type of treatment you offer work? What are the chances that treatment will succeed? How soon should I start feeling better? How will we assess my progress? What should I do if I don't feel better? How much will treatment cost? None of these questions get answered in today's world.
Yes.
But these are necessities before you see the therapist. You need to.
Patient should know that.
That's the patient's right. Actually, what you all are doing for patient's rights, this is the integral right of the patient to know before he
If you
starts
ask these
treatment.
straightforward questions, you will not get the
They'll
answer.
never give
But
answers.
you have to ask in such a manner that these get answered.
Absolutely.
You know.
No, but the problem is today
Conversation.
therapists and psychiatrists don't have time. They don't want to give you that time. It's
You're
hard.
prepared.
Yeah. It's hard for a therapist to give precise answers to some of these questions because no single therapist or type of treatment is best for everyone.
That's absolutely true.
Yeah. But there are some general responses you should be looking for. The therapist should easily be able to describe his or her formal training and certification. And while there's a tendency for mental health professionals to offer only particular type of psychotherapy that they do best, it's a good sign if the person can describe the merits and drawbacks of different types of treatment, including ones he or she doesn't do. It's also a good idea to ask a therapist to periodically check in with you about your progress. If you don't feel there's been improvement after several months, getting a second opinion is...
And nobody asks about options.
Absolutely.
What options I have. And they also don't accept.
They don't want to tell you about options because then they lose a patient.
Right.
So,
They say ki what I have thought for you is the best option.
That is usually that is the
Don't
answer.
waste your time and my time
yeah.
to going through all this.
So they also have this examination called a mental status examination, which focuses on the patient's current state in terms of thoughts, feelings, and behaviors. Draws a conclusion over an overall description of the patient's mental status, including general appearance, mood and affect, quality of speech, thought, content and processes, level of consciousness and cognition, impulsivity, ability to abstract, judgment and insight, and reliability. These are all parameters that they look for. So they look at general appearance and behavior, psychomotor activity, speech, thought, mood, perception and cognitive functions. So we've spoken about depression, we've spoken about therapists. Now how can you be of help to someone who's depressed?
That's very easy.
Know that you're needed and appreciated even if it seems that you're not. You need to listen to that person. Never say pull yourself together or cheer up unless you're also going to provide detailed, foolproof instructions. Tough love doesn't work. Turns out that just good old love is enough. Appreciate that it is an illness. Things will be said that aren't meant. When a person is in the throes of depression, that person will not be in control of his or her mind. It's like when you're angry, what happens? All the pent up emotion pushes thoughts into your brain which are all negative, and you'll be blaming that on someone in front of you, which that person might not be responsible for, but you'll still be blaming that person for it, and that person will be hurt by it because that person thinks you're doing it, you're saying it with all your faculties intact, but actually that's not true. When you're angry, you're not in control of yourself. When you're depressed, you're not in control of yourself. So you need to look at people in that way. When someone is angry with you and says something hurtful, don't take it personally.
Yeah.
Educate yourself, understand about all that what.
And the difference between psychologists,
They're very thin lines. Except for
this is my problem, which I always mock.
Sometimes because psychiatrist has
because they all do dual things. So
Please explain.
They are qualified also, no?
Yeah.
Depends on your
No,
qualification.
no, these are actually international qualifications. We don't have all these categories in India.
Correct.
We don't have counseling. We don't have. We have clinical social workers.
Counseling?
Counseling, but
Counseling
not exactly
psychologists we
clinical.
have, yeah. Clinical psychologists we have. Psychiatrists we have. Psychoanalysts are very rare.
Very well.
Psychiatric nurse practitioner we don't have.
No.
Pastoral counselors we do have. That's the priests who counsel.
I'll tell you about that.
Counseling psychologist is a psychologist who can also counsel. Okay, psychologists usually analyze and do those tests and all for you as to like those. We spoke about the examination. The previous slide was about that examination about psychomotor functions, and that's what the psychologist does. They try to examine those functions. Clinical psychologist also does the same thing. It's basically only thing that clinical psychologist is pure. It's basically they don't do counseling. They only do the
Pastoral
analysis.
counselor is only in the Christians, no other community.
The term is given.
It's just a term.
It's a
No,
term.
but this is my experience.
Yeah.
Parsis don't have it, Hindus don't have it, Muslims, I don't know.
No, there might be. See, the problem is
But the priest of the church does it.
the priest of the church does it definitely.
I'm sure about that.
Yeah,
I don't know about others.
They do, but what I'm saying is all priests.
Not formal.
All priests, they might not be formally trained to do counseling, but they have their own way of.
Because of their own skill, they
No,
will.
sir. Go and pray, do some
Religion
bhajan,
related.
go to Ganga, go to Jamna.
See, it helps some people. No, it helps some
It's
people.
all the time.
No, see,
But the way-
we can't debunk anything.
But the way fathers do it, Christian fathers do it.
No, they do it in a very structured manner, definitely, because they're trained to do that.
Saint Stephen's Church.
They're trained to do that. They have to go through the counseling courses before they.
Like, mainly to endorse faith in the
Yeah,
religion.
absolutely. So, and theirs is religion based. They'll always talk about God and they'll always talk about religion. So it's every religion
Even
has
the
that.
hospital at Bandra also, same business.
One of the reason is what you know, they are not behind the money.
not making
Yeah,
money.
they're not
Because the
from money.
Pandyas and all, they are telling you so that
Pandits and all,
They depend on Holy Spirit Hospital. They say very
They are making
spiritual.
money,
The
sir.
nuns come and
Making
they will
money.
come on your bed
Yeah,
and
they
they
talk to you.
So they have one kind of.
I heard that.
Yeah, they do.
And the patient sometimes feel better.
Because of the treatment, I mean.
They feel at home.
Yeah,
They feel that someone cares. See, we all need to feel that, no? I mean, why are we in relationships? Because we want someone to care about us, right? I mean, otherwise, why would we even bother
That
to maintain
itself is a
relationships?
healing process.
Yeah, that's a healing process. That's our need. That's an instinctive need.
Yes.
And the social animals.
Yeah.
It's without that we can't survive.
Correct.
And the social media.
They know everybody. All species are social.
Social media.
So this is how the hospital looks at healthcare.
Should be a doctor taking charge.
Yeah.
Communication.
Leadership, communication, situation monitoring, mutual support, knowledge, attitudes, and performance.
Knowledge is less now. Nobody knows what's happening in the hospital.
The thing is, even the doctors don't know what's
There as a nurse will say my morning shift was a nurse. No, the morning shift will say I was not there.
It's also because everyone's doing it as a way to make money, not as a
It's their job
calling.
to
Yeah.
come to work.
It's not a calling anymore. Those days are gone.
There are some people.
Very few.
Very few.
Very
Percentages now,
very
yes.
low. Be kind to your mind. Do what you love. Have fun with friends. Be active. Celebrate what makes you special. Eat healthy. Take a break. Connect with others. Give your time.
This is your favorite slide.
Help out. Share a smile. Sing. Give a hand. Sleep. Do things big and small. Be unique. Feel totally free to be silly. Giggle and laugh. If you don't like where you are, then change it. You're not a tree.
Yeah, good.
We go to dignity.
Mental health needs a great deal of attention. It's the final taboo, and it needs to be faced with and dealt with. Celebrate the small victories along the way. Surround yourself with the important things in life that bring you comfort and happiness. Friends and family, pets, enjoyable work and activities, humor, faith, physical activities, good nutrition, adequate rest and sleep, and a positive attitude. That was the message put out by David Sussman. We care about helping you feel good inside and out. If you're experiencing feelings of sadness and depression, we want to help.
Sorry.
So that's it.
Finish? But yeah.
Thank you very much.
Oh yeah.